My name is James Guerrini and I'm the Medical Director for Urgent Care Medicine at Wake Forest Baptist Health. What brought me to Wake Forest Baptist Health is actually I practiced as a primary care physician for Aegis Family Health Centers back in the 90s, which was affiliated with Wake Forest Baptist Health. Then I went to private practice in Massachusetts and decided that I wanted to return to the Carolinas. I practiced urgent care medicine for several years before an opportunity arose to be able to return to Wake Forest Baptist Health in that capacity, and it was a very exciting opportunity for me to rejoin the organization. My clinical specialties are family practice, and for the past 8 years I've also been practicing urgent care and occupational medicine as well. I chose urgent care medicine because my experience as a primary care physician showed me that there was an access issue to health care for many patients. And I find as an urgent care provider, where we can provide care to patients on a walk-in basis whenever they need it, I was able to deliver that care in a more timely fashion. And it's been more satisfying to me to be able to provide care when patients actually need it rather than having to have them wait for their care. My patient care philosophy involves helping patients achieve their goals by ensuring that they're an active member of the healthcare team so that they're making active decisions and being an active participant. And I know I use the word active over and over, and that's intentional because we really want to make sure that patients are involved in making their decisions. It's what's right for them to help them achieve those goals. What I enjoy most about working with patients, particularly now that I'm doing urgent care medicine, is to be able to help them with their acute needs and to be able to coordinate with their primary care doctor for any ongoing needs that they may have. And it's really enjoyable to work with them to help them solve their acute problems, but then also be able to give them advice and help them coordinate that care with their primary care provider. Recently, I've been a patient in the healthcare organization, and being a patient has helped me be a better provider because I got to really experience what it's like to be on the other end of the stethoscope, and it can be a really harrowing and scary experience. And what really was an eye-opener for me was I know a lot of the medical jargon, and even with that I was still scared, and it made me think that people that really don't know what may be wrong with them and have these concerns and questions may be afraid to ask their providers that, and it's opened my eyes significantly to how that affects patients. The biggest fun fact about me right now is I get to spend a lot of time with my twin 6-year-old girls. They're helping to keep me young and get me out there and exercise more. You know, since I've had to go through some issues with exercise, they've really helped me focus on that and have get me out into the track and walking and jogging with them, and it's been exciting.